let's review again this. Maybe you already know what is the specialty and the professionality of care worker. Okay? What is the specialty, professionality of care worker? Care worker should be professional to support one's daily living. Care worker is a specialist for arranging living environment for user. Care worker should be professional to encourage the user to perform activity of daily living and participate to social activity. So, keyword is this: everyday life support. That is care worker's specialty. So next, what is the everyday life and the usual life? Okay. Everyday life is daily routine that a person continues to do every day. Everyday life is composed of activities of daily living and social activity. Everyday life or usual life is composed of how people used to live along with one's sense of value and way of thinking. It is accumulated with one's past experience. Okay? Your lifestyle is based on your sense of value, way of thinking, your habit, your past experience, and something you are particular about. Okay? Based on these things, you create. Okay? You create everyday life. That's why everyday life is different. Everyday life differs from person to person. Nobody has the same lifestyle. Of course. That's why, in order to provide everyday life support, care worker should know every aspect of a user's daily life as detailed as possible and provide care accordingly. Care worker. Care worker should respect user, other human being, and individual. Okay? Keyword is this: human dignity. What is the human dignity? No. Why we respect the human dignity? Because human dignity is a principle of caregiving. Basic concept in the provision of support. That's why there are two elements in terms of Japanese way of caregiving. First one is caregiving that maintains dignity. And the second one is self-independent support. Okay? How we can hold or keep human dignity when you provide caregiving. We should consider how a user wants to live. So care worker should listen to what the user wants or needs rather than doing what the care worker wants or should do. Care worker assist a user to take the lead in daily living. Care worker is not the one who takes the lead in user's daily living. Care worker just assists the user to take the lead in their daily living. Okay? Listening to user. Respect user's sense of value. Respect user's lifestyle. So this is a summary. With the full understanding of the user's way of living, support the user to lead user's everyday life. Okay? That is a caregiving that maintains dignity. The next topic is this, self-independent support. But first, what is their independence? So when you work in nursing field in Japan, you hear often this word. How do you call this? Everybody? How do you call it?
Independence, jiritsu.
So, 自立, 自立, okay? 自立, Japanese word, 自立. That is a very important word. I think the key word in terms of caregiving in Japan, 自立. Okay? Then when you hear 自立, actually this is a combination of independence and autonomy. Independence and autonomy. So actually, even Filipino, you guys, you are very good at English, right? Better than me. I admit it. But when I ask you, what is the difference between independence and autonomy? Anybody can answer my question? What is the difference, independence and autonomy? Everybody? Everybody? Difficult? Grace, what do you think? If it's difficult, it's okay. You just pass. What do you think? What is the difference? Independence.
I guess you say independence is a state of being free.
Being free, yes. How about autonomy?
I don't know, Sensei.
Yeah. Me too. I think it's very, it's difficult, almost the same meaning, right? But if both words have the same meaning, why there are two words? Okay. So yes, the Grace-san say similarity of independence and autonomy is this, the idea of freedom. And the next, the ability to make one's decision and the choices. Okay, that is the similarity. The difference is this. Okay, let me explain. Independence first. Independence. Independence means the state of not being dependent or on others. Not being dependent on others. Another. The main focus is on not being dependent or influenced by others. Okay? So when you think the word of independence, physically independence and mentally independent. So actually other independent like financially independent or what else? Spiritually independent. But I just pick up these two independent because it's the most important. Physically independent and mentally independent. Okay, if you are independent, so you have an ability to perform activity of daily living. Or if you are independent, you have an ability to make your decision and then choices. Okay, that is the meaning of independence. Independent. 自立. Independent. Another 自立 is autonomy. When you hear 自立 in the nursing field, meaning is autonomy, not independent. Okay? Not independent. Then what is the meaning of autonomy? This. The state of being self-governed. Okay? Self-governed. Meaning you can take the lead in your daily living, right? Okay. Then the main focus is on individual power. Again, when you hear 自立 in the nursing field, 自立 is autonomy, not independent, autonomy. When you hear nursing field, autonomy. Okay, autonomy is mentally independent. Mentally independent. It doesn't say physically independent. Mentally independent. So that's why the elderly with dementia or the person with disabled, they are also, eligible. Right? I mean that they are also can live autonomously. Okay, autonomously by using social resource or someone's support. They can live autonomously because they have ability to make their decision and then choices. Okay, is that clear? What is the difference? Independence and autonomy. Main difference is this. Mentally independent. Both words contain mentally independent. But independence contains physical independence as well. Okay. The next is this. What is the self-independent support? What is the self-independent support? As I told you, in terms of Japanese style of caregiving, there are two principles. One, caregiving that maintains dignity, I already explained. Self-independent support. What is the self-independent support? Self-independent support meaning supporting the user living autonomously. Okay, living autonomously. There are two independence, right? Independence. Physically independence and mentally independent. Okay. Care worker support user to live independent physically, but not physically. Physical. Okay. So how we can provide caregiving with self-independent support? In the terms of physically support, it support related to physical movement in everyday life, like a morning care, or this activity of daily living, the dressing or excreting and moving. Physically support related to physical movement in everyday life. And another one is support to maximize users' residual abilities. Residual ability, remaining ability. Okay. So even though user needs someone's assist, someone's help, they still have a remaining ability, right? Care worker support to maximize users' remaining ability, like this, rehabilitation, or go out shopping together with user. User can work with care workers support with worker. Okay. So this activity is IADL, instrumental activity of daily living, like doing laundry or cooking or cleaning. I will explain what is the IADL and the ADL later. Okay. So, but I just want to know, when you support user physically aspect, there are two. Support users' activity of daily living, or support to maximize users' residual ability. Okay. The next is mentally independent. Mentally independent. Support the user to make decisions and choices on user's life. Like this. Care worker asks, which clothes do you want to wear today? User say, I think I will wear that sweater. Care worker assists the user to make a decision, right? That is a mentally independent. We assist user to live mentally independent. Or, what do you want to eat for lunch? You just give the choices, ramen, sushi, or tempura. Let him choose. Let him choose. Not care worker choose. Okay? So, independently choose and decide the style and method of daily living. Not only the activity of daily living, but also recreation or the vacation or social activity, anything that related to user's life. We respect user's choice and decision. Important is this. No matter what handicap we have, we will use our own ability and participate to social activity because we have a right to control our, daily living. Care worker assist users decision or choices. But some, mostly, not mostly, but in general, when you get older and when you have a disability, you are likely to be passive. You are likely to be passive. So that's why the care worker encourage user will and motivation in daily life. Like for example, ask user to do the laundry work together. Because, okay, let's say that she has a difficulty to work, but at least she can use a hand. She can help. She can do the laundry work. Okay, why don't we hold the laundry together? That is kind of this support to maximize user's residual ability. Let's say, actually, the shopping, in terms of the shopping, it's better for care worker to do it faster. But we should ask user, why don't we go shopping together? Okay, because user can walk, but very slowly. With care workers assist, user walk. We try to encourage her to go out, bring out her will. That is this. Support to maximize user's residual ability. But keep it in your mind, okay? Care worker must follow user's decision. If the user doesn't want to do it, like the refusal of folding laundry together or shopping together, let's say that because user is so tired, we should respect user's decision. Do not force her to do, even if it helps the user maximize her residual ability. What we prioritize is to respect user's will. Of course, as long as her safety is encouraged, ensured. Okay? That is a priority. That is a priority. Okay? Is that okay? So far, so good? Are you all right? Okay, good. So these two topics is it's a very complicated because it's a concept or philosophy. That's why I explain again and again for you to understand deeper. The next is team care. Okay, team care. Team care. So in order to provide everyday life support, we put the user at the center. Okay, we put the user at the center to everyday life support. Everyday life support. So when in order in terms of everyday life support, many professions, many occupations collaborate together. Okay, like the nursing field, nursing care, or medical care, or rehabilitation, or meal and then nutrition. Each field has different occupation or professional. Okay, then care worker is in the field of nursing care. Okay, again, so what is the specialty of care worker? What is the specialty or professionality of care worker? Everybody?
To provide everyday life support, Sensei.
Good. So this. Provide everyday life support. Why everyday life support is care worker's specialty? Because care worker is familiar with the user. And the care worker is the one who arranging living environment, right? Okay, let's see this. Compare with other profession or other occupation, care worker can become closest to a user, can spend more time with a user rather than other occupation. Care worker, that's why care worker know a user holistically. Care worker know every aspect of user's life. Only care worker can see the full picture of user. So that's why I can say care worker is a specialist of the user, because care worker spend a lot of time with user, closest to a user. That is the care worker's specialty. Okay, so that's why then so, you know that each occupation, profession has different specialty. Like a doctor is to diagnose and treat disease, right? Or PT to provide training of activity, training of physical activity. So each professional has different specialty. That's why, look at this. There is no hierarchical relationship among professionals. Each professional have the same goal, but different expertise to approach. Okay, there is no hierarchical relationship. We are equally treated because each profession has a different specialty. Okay, that's why if you consider care worker as an assistant of nurse or care worker just housekeeper, care worker has no specialty, how come you are treated as one of teammates? Am I correct? Care worker has a specialty. That's why care worker is a part of team. Okay? Then what is the care worker specialty? It's everyday life support. Are you okay?